Thanks, everyone, for coming in and listening to this informational webinar. Information governance is rising in importance in healthcare organizations, and it's certainly not the job of just one person. It's truly an organization-wide initiative that is growing in importance as digital data becomes more important. I'd like to introduce our presenter today, Catherine Downing. She's the Vice President of Information Governance, Informatics, and Standards for the American Health Information Management Association, which has been really taking a leading role in promoting the importance of information governance. Kathy provides her professional experience toward developing HEMA products and services through toolkits, articles, and training. And without further ado, she's got a lot of content. And Kathy, I just want to hand the floor over to you and let you get started.
Very good. Thanks for having me. I did see some notes in the Q&A that people were having trouble hearing, so I'm hoping that I'm loud and clear as we get started with a lot of the content. Happy New Year to everyone. Thanks for joining us on your second week back to work. What we're going to talk about today is information governance. We're going to do a quick baseline of the what, why, and also discuss the how of information governance. HEMA has launched an information governance adoption model for healthcare. We'll talk about that tool and the ability for you to use it in your organization. We're going to talk about implementing effective information governance and how to gain buy-in, and then also talk about other tools and resources available to help you measure and track your success with your information governance program. So HEMA defines information governance as an organization-wide framework for managing information throughout its life cycle. So that's from creation, where a provider perhaps is entering information into an electronic health record, through maintenance, providing access to that information either within the organization or outside of the organization in support of the organization's regulatory, legal, risk, and environmental requirements. Information governance determines accountabilities for managing information. You might hear terms like data owner or data steward, protecting information through privacy and security, and also helps provide repeatable processes that you're following so you maintain compliance around information. Information governance for healthcare, from our perspective, is all types of organizations. So it's not just for hospitals. It's certainly not just for a certain part of a hospital. It's not just the electronic health record. It's all types of information, whether clinical, financial, or operational. It's information on all media, so it's just not electronic. It's also that paper that maybe you have stored off-site or stored on-site, and it's all types of organizations. So when we talk about information governance, we often talk about the business associates involved as well. So if an organization has good information governance internally, they're going to need to ensure their business associates also have good processes in place, because so often the business associates have large amounts of information on their systems as well. And a lot of that has been exposed as we hear more and more about business associate breaches in the news. So this is where I just wanted to get a feeling from you as we dive into information governance about your understanding of what information governance is. Information governance has certainly been around in other industries, but healthcare has been talking about IG since 2012. So the first answer would be, I don't really have a grasp of what it is. Or the second, I understand what IG is, but I'm not yet able to apply it or start it in my organization. And then the third option there is I understand what IG is and I have started projects in my organization. So I'll just give you a moment there to submit that response, and then we'll see what kind of responses we have from the group on the next slide. Okay, so we're about almost even into thirds here. Just a few more maybe in I understand what it is, but I'm not yet able to apply it category. Well, that's great. We're going to be talking at all levels, so regardless of where you are currently in your organization, I think you'll have a lot you can bring back from today's discussion. AHIMA recently did a 2017 survey asking leaders of organizations from all different types of departments and all different types of organizations and, asked, are you familiar with the idea of information governance? And the good news, again, very similar to what we saw in our survey, 84% were familiar, and then 15% weren't really familiar with that term. How would you describe your organization's status as it relates to information governance adoption? So much like our poll, several types of organizations had programs initiated and they were starting to realize benefits. But most of the organizations were sort of in the middle there, where they had, maybe some efforts underway, but not a formal program, or they had a program initiated, but they weren't yet tracking to benefits and that return on investment in information governance. So all across the spectrum, and really this is, the marathon effect of any sort of new idea that comes across. The white paper, by the way, if you're interested in downloading it, it's available at ahima.org/IG resources, which I do have there. And there's obviously a lot more detail related to these graphics in the white paper itself. What about organizational drivers for implementing information governance? So when we asked our 1,500 respondents, what is really pushing the idea of IG along, that idea that analytics and business intelligence and, being able to have good business intelligence is going to create a competitive advantage. Organizations who are able to look across systems, get the information they need, especially as they consider adding new types of services in the organization. But 15% also said that there are data quality issues. That could certainly be due to how the EHR is set up. Also be due to something, as simple as physicians using copy-paste, or other technologies, that are maybe causing some data quality issues. Or it could be that, the C-suite is getting reports and saying, gosh, this really isn't adding up. This isn't what I thought it was going to be, and then not trusting the data from that point. Patient safety is also cited, patient engagement, and on down the list as far as drivers for information governance. The good news is healthcare organizations are succeeding. We do see some organizations being able to track specific benefits and return on investment. And we'll talk through some of those as we walk through today's presentation as well. So AHIMA's information governance adoption model is made up of these 10 organizational competency areas. And what we had done is AHIMA, in partnership with ARMA, had launched IG principles back in 2014. And although the principles were sort of good fundamentals, we weren't seeing a lot of movement with information governance across healthcare. And so now we talk more about the competency areas. So if you look around the 10 competencies, you'll see how each of those is tied to information governance. And under each of the competency areas you see here in the model are maturity markers. So under data governance, for example, there are maturity markers around data quality, around metadata management, or master data management. And those are all part of one of the competency areas of information governance. A lot of people get data governance and information governance confused. Data governance is a key component of information governance as it looks at the quality of the data, and you have to have good data to have good information. But it's not a one-to-one because information governance is a much higher level program and includes things like privacy and security of the information. Are you meeting your legal and regulatory aspects related to information? Are you able to do advanced analytics, informatics, and get business intelligence from your information? IT governance is another competency you'll see here. How are you handling IT changes or IT decisions and looking at the use of information? And then the other competencies that I haven't mentioned are IG structure, which is around how are you establishing your program? Are you using a multidisciplinary committee? Do you have an executive sponsor? Strategic alignment is going to say that when you create an information governance program, it needs to be in support of your organizational strategies, your mission, your vision, your goals. And IG certainly does align with, what you're trying to do, whether it's provide effective care to the populations you serve, et cetera. Enterprise information management includes health information management, but remember that the IG model is all information. So there's also information managers in human resources, information managers around the financial information, accounting, and things like that. So it's not just health information management. And enterprise information management also includes things like how are you providing information to the patients? Do you have a patient portal? Is all information available through the portal? So all of that would be markers underneath enterprise information management. And then to swing around the other side of the circle, awareness and adherence, meaning what have you done to make sure your staff is aware of their responsibilities around governing information? And then performance is performance of the IG program itself. So we'll look at some of the markers underneath these competencies a little further into the presentation. Another survey question, which of the following information governance competencies are you most familiar with? In this case, we found analytics was number one. Again, it's a driver, so probably a lot of analytics respondents. Data governance is another area where organizations, where individuals responding felt like they had some knowledge, and privacy and security shouldn't be surprising. Information management, IT governance, et cetera. What functions or operations do you believe would benefit most from information governance adoption? Analytics, business intelligence, and informatics came up first, followed by compliance. Interestingly enough, we have a lot of compliance officers that are very involved with information governance because they understand and they sort of know behind the scenes what's going on with information as they try and use it or as they deal with compliance issues related to information. So that's another key area that would benefit from having good, trusted information across the healthcare system. So when you look at information governance, you're looking for reliability of the information, but also in support of both privacy and security efforts, having, the right access, the right people at the right time, applying minimum necessary and all the legal requirements, but also patient safety. As you, work through systems, if you've seen, the erroneous information that ends up in a chart, oftentimes that can create a patient safety issue. And obviously, you've also got some patient satisfaction mixed in there as well, because as we provide more and more information through the patient portals, and under the 21st Century Cures Act, we're going to be challenged at the end of this year, by the end of 18, to provide everything through the patient portal and not just labs or radiology. That's going to really offer an additional challenge as patients start to see their full medical record and engage with it. You're hoping that the information is reliable and trustworthy and that they aren't having to come back to you and make corrections because they're seeing incorrect information or, heaven forbid, somebody else's chart intermingled with theirs. So all of you have experienced the why of information governance. Healthcare data is a little, more complicated when we talk about banking or finance, and, in banking I can go to any bank machine on the planet and get money out of my bank account. Why is healthcare so complicated? And a lot of that is because we've got complex information, we've got structured and unstructured information, we've got different formats coming in, including multimedia. It's not just numbers and identifiers. So things do get more complicated for healthcare. But again, that is focusing us back to why we need to have an overall information governance program. So let me dive a little deeper into AHIMA's IG adoption model. We started to, think, how can organizations really better measure their maturity for information governance? And that's where we came up with the idea of the 10 competency areas and the maturity markers, the markers of maturity under each. And the idea is that if you can measure where you're at for each of the competency areas, you can see which competencies you maybe need to focus on, or if you've got, several competencies, you can start creating your roadmap when you're starting to implement an information governance program. So it gives you a more step-by-step method. And honestly, one of the things we hear about information governance is, I want to get a program started, but it's just kind of overwhelming because it's such a big, project for my organization. Again, that's why we came forward with the idea of the IG adoption model, where you can figure out where you're at, measure where you are, and then create, a roadmap based on maybe some of your risk areas. So the adoption model is available through a software called IG Health Rate. It's free to qualified organizations. It was built not only by AHIMA, obviously, but by several organizations of all different sizes, including hospitals, children's hospitals, universities, IDNs, public health organizations, health information exchanges. So lots of input from many different types of organizations across the healthcare ecosystem as we built out the model. We'd go into an organization with the IG adoption model in the beginning, and we'd be talking about security, and the chief security officer would say, well, you're asking for these pieces, but you've missed this. And so we've got a lot of validation through the 100 or so organizations that tested this for us. Bringing value to the organization is key, and the idea with Health Rate is that you're creating that pathway where you move up the levels based on your organization's goals. So if you want to move all the way up to an IG level 5, then you certainly would have that to list on your website and have as a competitive advantage. The AHIMA model is a 5-level model. I mentioned that level 5 is the top. Because we're AHIMA, all of the levels are named with A words. Level 1 is at risk. So an organization on a maturity marker that's at level 1 is probably going to have some risk around that specific information governance aspect. Most of healthcare is a 2 or a 3 for most of the markers, which in those scenarios is really, you've got some pieces of information governance going maybe at the department level, but you don't have an enterprise program looking across departments and sort of eliminating those silos. And then through level 5, which is actualized, you've really integrated information governance into how you design, build systems, and interact with the systems. So I just wanted to give you an example of what a marker would look like in the software, and I chose this IT change management just as our first example. So when you look at level 1, the organization maybe has some idea that that change management is out there, but they aren't using any framework when they make changes to hardware, software, or IT. At level 3, there's change management processes in place for production environments, including changes to hardware, software, assets, or projects, including new servers, modifications, and so on. But maybe it's just for specific systems or it's just for production. And then at level 5, you've got a change management framework in place. You've got projects going live with well-thought-out programs related to change management. So this is under the competency area of IT governance, and it's just one of the markers, which is IT change management. So building the case for information governance really means tying into your organization's mission, strategies, and goals. So you're trying to determine how information governance can contribute to maybe safety or quality of care, if you've got population health initiatives, certainly operational efficiency and effectiveness, and cost reductions around information. I'm going to give you some specific example of those as we work our way through today. So how does IG Health Rate work in a normal organization? Generally, what we recommend is that it's not done in isolation by one individual, that there are some level of group meeting to discuss each of the 10 competencies and the associated maturity markers. So you go through each, you have a discussion, and you decide as a group where you are, whether it's a level 1, 2, 3, 4, or 5 for the maturity marker. Across the entire model, there are about 75 maturity markers. So it doesn't take, more than an hour or 45 minutes per competency to get through. And then the groups we recommend by competency are listed here. So generally we group some of the competency areas together because the same people would be in play. And an example of that is to discuss data governance, IT governance, and analytics. We're going to recommend, that if you've got a data governance leader, whether that's a DGO, a data governance officer, or somebody in IT, if you've got decision support, business intelligence, analytics type people, they would get together and they would go through all of the markers that are under the data governance, IT governance, and analytics competencies. And that would take about an hour to get through the markers, and then they could understand where they are related to that specific area. The system looks like this. It's, very easy to work through. The competencies are along the left-hand side. You move through. There's help text along the way if you don't understand what something is. So it is very easy to navigate in organizations using it, just, work their way through, like I said, in a team effort to the best of your ability. Certainly not hard to use, and we don't actually even provide much training except a quick training video that's at healthrate.com, and that's really all you need. I wanted to provide just a couple more examples of maturity markers. The identity management marker is an example of an enterprise information management marker, and this asks, how are you handling identity management? And this includes the master patient index as well as other indexes such as your physicians or different vendors involved. So how are you handling identity management and making sure you don't have duplicates, that you've got a good source of truth? And so you'll see level 1, correct identification is sort of ad hoc. There's no methodology or technology. At level 3, you've got policies, you've started to look at, control processes, you're understanding what your situation is around identity management, all the way up through level 5, where you've got you and your partners both work together to make sure you minimize issues with identity management and you've got good, accurate person identity. And then I mentioned data governance is a key competency area. This is effective use of data stewards across the organization. And so this example, again, if you're at level 1, you're at risk, you haven't got data stewards. Level 3, you're starting to implement. And then at that level 5, related to data stewards, you've got a good, robust program around data stewardship. So what does it look like then when you answer all these bubbles and you get to the end? What you get is a report, and it provides you your IG level overall at the top, and then it provides your information governance maturity level by competency area across those boxes there in the center. You can click into those boxes to go a level deeper and see, where, I'm surprised I'm a level 2, let me look into that, and it'll give you all the detail behind. And then at the bottom of the page, you have the ability to compare your score to your peers across healthcare, depending on how you set up, in the system, how you want to be compared, if it's to other children's hospitals or university hospitals or IDNs, et cetera, or in the vendor space if you want to be compared to other, release of information vendors. And it compares you by competency area. So you can see, okay, we're ahead of the game as it relates to most competencies, but maybe we're a little behind on privacy and security. And then you can also compare on that sheet to your baseline. So as you do your assessment every 30 or 90 days, you can see how you're moving things along within the system. And there's just one other thing I'll mention. Because, again, our goal at AHIMA and one of our strategic missions at AHIMA is to advance information governance in healthcare, we have built this free system with coaching. And what that does is it, for each of the markers, provides you your next steps. It provides resources, whether it's, on a government webpage like the Office for Civil Rights, or if it's in AHIMA's body of knowledge. We link to all types of different information to help you move along in that specific marker and in that competency to help you succeed as you sort of create that roadmap and try and figure out what to do next. So AHIMA's IGAM levels are 1, 2, 3, 4, and 5. We do provide awards, much like HIMSS, HIMSS level 6 and HIMSS level 7 sites. You'll see we have IGAM level 5 as our top level, and that's an organization that has really integrated information governance across the enterprise. IGAM level 4, and then IGAM level 3. So those are, you'll see organizations with some of those symbols on their site, and that's what those are. So after an organization does their assessment, they figure out where they are, and that is how they can create their action plan to figure out how to move information governance forward. It allows for project prioritization, and that using Health Rate has been very beneficial to organizations because it's extremely educational about what information governance is. The light bulb comes on when you bring the group together and you start flowing through the markers. It gives them a real concrete idea of what information governance is, and a lot of times the issues that you discuss while you're talking about the markers for analytics, et cetera, are issues that you have that won't take much to resolve if you just can kind of get a plan together. And so that's what Health Rate is meant to have you do through the coaching and the scoring. So building a case, as it relates to prioritizing projects, we're going to recommend that you certainly look at your risks. So as you do the Health Rate assessment, you're going to come up with some level 1 markers. You're going to need to evaluate if they're providing, if they're causing a risk issue, you're going to want to look at those. But also cost reduction is key. Information governance programs should reduce costs in many operational areas around information. Improve compliance, improve productivity. One of the aspects of information governance is sort of that EHR governance functionality. And so, when we hear physicians say it takes 6 times longer to enter information into my electronic health record than it did when I was on paper, I always want to sit down with that person and say, okay, talk to me about how you're interacting with the system. We must have done something wrong if that's the case. Is it our templates? Are you, trying to free text in where we could maybe streamline for you? And so that's an example of it, an information governance project that would increase productivity, probably increase the value of information, and certainly increase satisfaction with your users. You do want to include key performance indicators for all IG projects, and I recommend, if you've got a project management office, that I would, recommend using the PMO to assign a project manager to these very, sometimes multidisciplinary long-term projects as you bring up an information governance program. So what is the cost of poor information quality? I think you've all experienced this. Certainly you could miss opportunities. You have reductions or delays in payments. You have issues with patient satisfaction. If people are seeing things in the portal or if they're having to call because they're getting, information on their bill that isn't correct for services that weren't provided. Also, forecasting by leadership. If the leadership team asks for a report and they get it and they think, oh, yeah, I'm not confident in this, then, you've done work for nothing and you're delaying decision making, and that's a cost of poor information quality in healthcare. We talked about productivity and those EHR issues. I would also, as it relates to EHR issues, I would argue that there are some pretty significant security and privacy issues related to EHR workarounds. And I'll just give you an example. I have, all of my physicians who are all my friends growing up who are now physicians, I'm always interviewing them about how's it going with the EHR. I know you just went up on Epic 18 months ago. How's your life in the new world? And one of my friends, she's an orthopedic surgeon, and she said, nobody ever customized anything for us in orthopedics, so we just kind of make do. But one of the things that we can't get in the system, and it's not an Epic issue, this is just nobody's turned it on for them at their facility, is a way to track patients that are possible subjects for a research study. So she said what we do instead is on our iPhones we use Notes, and we share the Notes app so that we can put the patient name in there and assign which possible research project they might fit into, and we share that with the researchers in the organization, in the university health system. And I'm like, okay, that is a HIPAA violation, and there is a way to do that in the system, but she doesn't know who to go to. And so one of the ideas behind information governance is there are those data stewards. People know where to go if they're creating a workaround or if they're doing something they know is a little bit off key, that they know where to go. And so that is obviously going to support risk and compliance. And there are lots of other pieces certainly supported there. One of the things that we have done as we try and educate our members and all of healthcare about information governance, and we talk about, when you're talking to the C-suite, you need to talk about information governance directly related to what they care about. So if you're talking to the CFO, you're going to talk about information governance as it relates to, reimbursement, maybe performance-based contracting. If you're talking to the CMIO, the Chief Medical Information Officer, you may be more focused on the aspects that include care management, coordination of care, and patient engagement. And so to make things easier across healthcare, we took all of these C-suite examples and how information governance supports the C-suite and the things that they care about and that they're concerned about in what we call the IG Executive Training Video. Now, all of our information governance resources are at igiq.com, which is sort of our home page for everything information governance. This one's also available at igadvisors.com. And the executive training video is meant for, a practitioner in the organization, whether it's compliance, risk, IT, legal, to be able to go and sit down with an executive and say, there's a quick 3-minute overview of information governance, and then we can click on, some interactive buttons and get you information about how an information governance program would benefit this organization and you specifically. So the first few minutes of the video are just the 120, foot level overview, and then you interact with the video. And so again, that's something that if you want to implement information governance, but you're not necessarily ready to be the one doing all the talking, that is a resource that's obviously, free to everyone in healthcare as we try and meet our mission of advancing information governance across healthcare. So one of the organizations we work with, when we talk to her about, how does she see, how has she been so successful with information governance? She said, no problem, it's 8 easy steps. And I had to put easy in my air quotes, in my quotation marks, because, they had a good program going. They had a multidisciplinary team. They definitely had C-suite leaders across the organization who, this is a children's hospital. They're about being the best. They really want to have good information. They've had their Epic system in for a while, so, they're not newly implementing something like that. And so what she said was, it's about engaging leaders, and then once the leaders start showing interest, a cross-functional steering committee was formed. The committee did create a charter, and they used HealthRate in this case to do a gap analysis so they could understand what they wanted to focus on. Out of their HealthRate results, they defined their strategies, and then they created a plan. And I will tell you what they did is the steering committee didn't get together once a month and do the things that needed to be done. They broke down into smaller groups that met more often to get, certain tasks completed along the way. They communicated and they reassessed using HealthRate Copy Forward. It just takes about 5 minutes to set up your reassessment. So that part is easy, and that way they could track their progress. And by seeing the progress month after month, that was motivational to the team. It gave them, okay, it feels like we're just doing these little things, but we are moving the needle as it relates to our information governance implementation. This is an example of how she broke out the competency areas and who was the leader for that specific area to move the competency, the markers, to the higher levels under that competency. And so this was just their example of how they divided it up so that they could have different groups, sort of leading the effort related to the 10 information governance competency areas. So I wanted to share that with you as a best practice as well. So, from any program you're implementing, including information governance, you're going to look at, the processes around, what policies do you have today related to record retention? Are they department by department, or is there any centralization? Who's accountable for following the record retention policies? What is your stewardship? And all the way through until you get to that point where everybody realizes their responsibilities through an awareness program around the information they're creating, the information they're accessing, and the information they're responsible for maintaining. There's obviously both people and process, and so we also wanted to share, oftentimes you've got an information governance, multidisciplinary team focused on policy setting, reviewing, updating policies for the organization. But at the same time, you're going to have some data governance aspects running. Maybe you're working on, a data quality program. Maybe you're implementing master data management. You're looking at access controls, et cetera. So oftentimes there are multiple, avenues of information governance running concurrently. I told you I would bring forward some of the cost savings around information governance, and record retention is one that's, sometimes in some organizations, the low-hanging fruit around that off-site, paper that's been stored that nobody's looked at, that certainly met the retention requirements. In some cases, honestly, when people start a record retention review program, they pull boxes from their off-site storage vendor, and when they look in the box, they find out that there's Christmas decorations in there, or there's old policy, manuals that were, not originals, but somebody just cleaned out their office when they left, and they packed everything up into boxes and shipped it off-site, and we've been paying to store it for 12 years or whatever. So, that idea that records management, that retention, record retention can be a cost savings is almost guaranteed. Electronic archival. In their case, they took email down to 69 days, and that saved some money. And so as soon as it hit 69 days, it went to a slower, more offline server. They could still get to it, but it decreased their costs for that most expensive type of storage. And then also, and this is an area that most organizations have a HIPAA compliance issue with, and they don't even realize it, is storing PHI outside of the electronic health record on public drives or shared drives or hard drives. And that is an issue because, it's not as protected. Oftentimes it's not firewalled off like the EHR is. And so you've got some significant risk there as well as you're storing, anytime you're storing, shadow records outside of the source of truth, you've got risk and cost. Another example from another organization, record storage came up again, space savings, cost savings, and they also looked at Active Directory cleanup, looking at single source of truth, accountability around information. So IG, in our opinion, should provide a competitive advantage because it should improve your, ability to be agile. It should improve your trust in information. And it really is a good way to move, information forward as we get into the world of big data with the electronic health records. So where to start? Certainly if you can use Health Rate, like I said, it's free, just get in there and start to do that assessment, with the help of a team. It's very educational, and then start to create, that program. Building the IG team is usually part to begin, some sort of multidisciplinary team. I'm never going to say start a new committee. I'm going to say look at your existing committees and see who's already got some information governance responsibilities and start to talk there about the IG program. So the example I use is, if you have an active privacy and security committee that meets monthly, it's multidisciplinary, maybe you're looking at your cyber risk, et cetera, that's a great place to start talking about IG as it relates to privacy and security and even the bigger picture items, and use that team you already have in place versus creating a new team, because that is, always difficult. You're going to analyze trends, within your organization and across healthcare to kind of create that buy-in. And also, share, look at industry best practices, talk to others. 21st Century Cures Law, in my mind, we all have to be in compliance by December of 2018, and organizations are very behind on compliance with cures. A lot of organizations are like, what is 21st Century Cures? I didn't realize a hospital would be affected by it. 21st Century Cures is ultimately about curing the incurable, but it has significant changes for privacy, for security, around patient access, interoperability, and so it's got effects, every hospital is essentially going to be touched by the 21st Century Cures, and a lot of that is around patient right to access, because a lot of the congressmen and senators involved in the law have had issues with getting their charts for their family or themselves. I mentioned the white paper is available if you want to download and get more information. There's certainly a lot that I didn't cover around that information governance white paper. And I mentioned IGIQ.com as sort of a one-stop shop for all things information governance. We also provide blogs on, case studies, best practices, organizational experiences around information governance. So if you're interested in submitting a blog, especially those of you who've got a program started, we would love to hear from you. But certainly if you're just interested in learning more, you can look through those blogs. They've been around for several years, and there's lots of information there that you can tie into. AHIMA's Body of Knowledge, also every single month in our Journal of AHIMA, we have an information governance case study success story. And so those are available, through our Journal of AHIMA website. And like I said, there's one per month. And it's about, tackling current projects. It's about organizational success stories. And one of my favorite success stories was, one of the keys to getting your arms around information in order to start the program is this idea that you need some sort of information asset inventory. And I will tell you, Ileana Peters from the Office for Civil Rights also says that you should have an information asset inventory, because if you don't have one, how are you doing proper risk assessment under the HIPAA security rule? Well, doing an information asset inventory can be quite a big project if you haven't got it started already. And so interestingly enough, this organization in this particular case study used students to help build their information asset inventory. And the students went around from department to department, interviewing department heads, finding out, what systems are used in radiology, what is the radiology director, the business owner for, is there a data steward, across the organization, and created that information asset inventory, which then allows you to do your proper risk assessment and your mapping of information. AHIMA has a one-time-a-year Privacy, Cybersecurity, and Information Governance Institute, so I wanted to just share that date with you. It's in September, attached. It's pre-convention for our convention in Miami. So if any of you are interested in taking a deeper dive and getting IG training specific to healthcare, we're one of the only organizations that offers anything that's healthcare specific, and AHIMA certainly would be looking for you there. We also have several IG webinars, if there's anything you might be interested in, and virtual meetings. We do a 2-day virtual information governance boot camp. It's just, a few hours per day with, your IG team in the room, et cetera. The one in April is about data governance and analytics, and then the one in July is about electronic health record challenges and how you address those through an EHR governance program as part of your overall IG program. So that health rate is certainly your first step, and I hope you will engage with the system as you start to work through and, create your information governance program there. IGIQ.com, there's lots of other resources. We have an IG toolkit. It's free to AHIMA members. So if you have, if you're an AHIMA member, if not, it's only $79 to be a member, so you could certainly join, but you probably have somebody in your organization who is. And so the toolkit is a great way to just, it's a free resource, and it talks you through how to get started. It takes a deeper dive into the competencies, how to establish your committee, what a charter might look like, et cetera. So for sure use that resource that would be, again, free to members. And with that said, I am going to hand over to George, who's going to talk more on his end, and then we'll have questions and answers at the end. So, George, are you ready to start?
Yes, I certainly am, and thank you, Catherine, for a very interesting and thought-provoking discussion. So I lead the team that designs, develops, and supports Dimensional Insight's healthcare analytics solution product line. And the discussion very much resonates in terms of how we're thinking about governance, particularly as it relates to analytics. So I wanted to share a few observations from the work that we've done with our own customers as it relates to the evolving convergence of governance, analytics, and collaboration. So historically, the focus of analytics initiatives has been on integrating and transforming the raw data from various transactional systems into information that's useful to decision makers, both on the front lines and the back offices. But how well that information actually supports decision making depends pretty heavily on governance. So it's actually pretty difficult to get analytics right without incorporating governance and including stakeholders in the processes around defining and then continually evolving information. You can really look at the analytics process as somewhat of a continuous loop of information refinement and knowledge creation, and in particular as the information consumers that we're showing kind of over on the right-hand side of the slide here, as they use the information that's been defined by stakeholders, they develop new insights that can contribute to the process of refining information, provided that those insights can be captured and incorporated. So that's one opportunity, to incorporate knowledge as it's produced through the natural process of using information. Another opportunity is to streamline the overall process of knowledge harvesting to make it more efficient and more responsive to evolving requirements, because the nature of an analytics system is that it's got to move very quickly because the requirements are always changing. As soon as you get one insight, that's going to produce a few more, which means that the system has to evolve quickly. But the traditional process tends to be pretty IT heavy, and the challenge there is that it relies on scarce and typically expensive resources, that's IT, and that much can be lost in translation between the subject matter experts and stakeholders who have the needs and the developers who ultimately implement the systems that will get used. We refer to that phenomenon as friction, and it also applies between stakeholders and information consumers as well. So we think a more ideal approach would be to give stakeholders and subject matter experts more opportunities to play an active role in defining and even creating the systems that deliver information for data-driven decision-making. Much of that process can be streamlined through technology and automation, and the potential advantages of that are quicker implementation cycles, ultimately more meaningful information, and better communication and collaboration among stakeholders, subject matter experts, and information consumers. Because ultimately the goal is to get to, as in attain, systems and information that make it intuitive as well as straightforward as possible to confidently and quantitatively answer important questions like how should we segment our patient populations, where's the variation in practice patterns, and what impact is it having, and what will be the impact of risk-based and quality-based contracts as we begin to move into them. So we're using these concepts as guidelines and guideposts as we develop our analytics solutions. So if you're interested in these topics, we'd invite you to download a white paper by Jennifer Bresnick of healthcareitanalytics.com that discusses some of the trends that I described, and also to explore the actual experience of Dimensional Insights customers in the case studies section of our website. So thanks very much for attending, and back to Fred.
Thank you very much, George. Appreciate your support of this. We move into a time for some questions and answers. We have some that we can start with. If you have any questions for Kathy regarding her presentation and information governance, I'd encourage you to type it into the question box below, and it'll pop up, and we can ask her all those tough questions that you're dying to have answers to. Kathy, I have one question here. In the HEMA's IG adoption model, there's a competency area for enterprise information management. What aspects of information governance are you measuring under that competency area?
Oh, yeah. Okay, that's a fair question. So enterprise information management, we kind of see a little bit of a three-legged stool between enterprise information management, data governance, and IT governance. And sometimes, how the markers fall, it's just how they best sort of worked out. But the markers that you would see under enterprise information management would include things like the information asset inventory, appropriateness of information use, sort of policies and practices, life cycle management, retention and disposition would also fall under enterprise information management. You saw the identity management marker, that's under EIM. As is a marker called information sharing, and that relates to information sharing with patients, clients, residents, and their representatives. So that is where you get into, how are you sharing information? Do you have, a patient portal? Is everything available in the patient portal? So, sometimes you would think, that might fall under IT type structure, but it is a part of enterprise information management. So those are just some examples. EIM and DG are probably the two biggest competencies as far as how many markers they have underneath them, just because of the sort of the vastness of those areas. So, do you think that answers the question?
Yep. Yeah, I think that's really good. I have another question that popped in. During some of the early survey slides that you mentioned, there were some organizations that say there's not they don't have an official IG program, but there are some efforts underway. What do these early IG efforts, what do they kind of look like?
Yeah, so interestingly enough, some organizations, in order to start education around information governance, what they'll actually do is they'll look at all of their projects that they have in flight right now. So let's say, you have got some sort of master patient index cleanup process in place, where you're doing, large-scale MPI cleanup, something like that. It's information governance. It actually, it's a marker in the adoption model. You have, a lot of work being done around that identity management or a physician master cleanup, for example. And so what they do is, they'll put them in kind of a grid. They'll say, these are our projects in flight, and they'll classify them according to the IG competency area so they can start tracking projects that they already have going for, around information governance. So the idea there, of course, is that you don't have to have, it doesn't have to go in a certain order. Okay, we get an IG committee, we write the IG committee charter, and we start doing projects. Projects you've got going on right now would certainly benefit your information governance program overall, but it's just about starting to align them, starting to use that terminology, and classify them so that, when those, are completed, that you can start on another one. And then also, like I said, the assessment itself, and you'll start seeing, as you complete that project, you may move from a level 3 to a level 4 or 5. So you can kind of see that forward motion. I mentioned, IG projects, some of them, depending on what's going on, can be big projects. And so as a project manager, I'm always going to say, having somebody helping you with the project management aspect, really makes a difference. So for those larger projects, please consider doing that if you have a project management office as well.
In addition to project management, are there other key stakeholders that definitely need to be involved, that are really having certain roles involved, are key drivers in a successful IG initiative?
Yeah, when we looked at sort of who should be at the table for each of the competency areas. And I think, your health information manager, your compliance officer, IT, whether it's the CIO or, different IT managers, and data analytics are probably involved in most of the meetings. Other information managers, HR often has a lot to contribute, through all of the different areas, because they, again, they're seeing, issues come up around access or, misuse of information. So they, without giving specifics, they're kind of getting some of that knowledge. So I would say, along with compliance are probably, main stakeholders who do a lot of the decision making around IG projects, moving things forward. And they may not be doing the work itself, but they're assigning that work out to get it done and get things moving.
Okay. You kind of mentioned that analytics is obviously one of the key organizational drivers for information governance, and for a lot of organizations, they're trying to do more with analytics. Why is analytics so crucial for? I guess maybe you could turn that around. Why is information governance success so important to an analytics efforts?
Yeah, it really is, around that both reliable and trusted information for analytics. And, I'll give an example. The CEO decides that he wants to know, how many patient falls they've had when the nurse is on the 11th hour of their shift. And so certainly you've got somewhere you're tracking patient falls, and then somewhere you're tracking nurse hours. But how easy is it could you right now, is there somewhere right now you could go and get that report, or would it take a lot of, trying to manually figure this out? And, how agile are you? And I would say when you look at organizations that are extremely successful across healthcare, and I'm just going to give HCA as an example, they have a centralized data warehouse. I'm in Houston, Texas. When there was a hurricane, they could, from Nashville, from the corporate office, decide which patients were the sickest in those hurricane path hospitals and move them out before the hurricane came. And move them out to their other hospitals, right? So they're not just, they're keeping them sort of in the HCA system, but they're able to manage all of that, from a central location. And so I just think there are organizations with some advanced analytics that are having competitive advantage, whether you're realizing it or not. That they've taken the efforts to implement information governance to standardize different things and have good information governance in place, and then all of a sudden they've got the ability to do some of that advanced analytics and have that business intelligence.
Okay, and we did have one additional question just come in. How applicable is the HEMA-IG model to nursing homes?
Yeah, honestly, it's built for all of healthcare. So we have, regardless of, whether you're on an electronic system or not, regardless of if you're, a provider or, like I said, a release of information vendor, across healthcare, it's meant to be used for all of healthcare, because we really do feel like, the idea of information governance is important to all of the pieces and parts of healthcare. So, certainly a nursing home, physician practice, anybody could engage with it and get out of it, a good report and kind of understand where they are. So it's definitely worth looking into, even at the nursing home level, with it, whether you have an electronic health record or not.
Hey.
Great questions, everyone. Thank you for sending them.
Yep. Well, we are exactly at the top of the hour. Kathy, I don't know if you have got a stopwatch there, but you timed it perfectly. I do want to thank everybody for listening in on this session on how to improve collaboration to achieve better information governance. We want to thank Dimensional Insight for the sponsorship, and we hope this has been helpful to you. Wish you a good rest of the day, and thank you very much for tuning in today.